It's a bird.
It's a plane!
It's the Luke guys.
Hello, everybody. So, we got a request from one of our many viewers to read and go through this article and talk about it. What we're going to talk about today is called Busted 5 Common Sports Injuries and Recovery Myths. Dr. Tom.
Now, just so everyone knows, we haven't looked at this article yet. The only thing that Aaron and I did was just look at the title and see, like, hey, you know what? This might be something interesting to look at. We haven't read it yet. So what you're going to see is exactly what we think offhand, pure, raw footage of our opinions on these myths.
Yep, and we're going to have a little bit different of a format today, but hopefully everybody likes it. Maybe a little more stuff going on than just our beautiful faces. And here we go.
Yeah. Look at that. Wow. We're upgrading on this channel.
I am so good at editing that it's unbelievable.
Believe it or not, this is what 109 subscribers allows us to get.
Yeah. So we'll get right into it. There's 5 different myths. We're going to go one at a time, make them look pretty. And number 1, applying heat to an acute injury is what you are supposed to do, I believe.
So they're saying, they're saying that applying heat allows for an increase in circulation to the area, which can result in increased swelling and inflammation. This can slow down the healing process. So basically, Aaron, they're actually saying to not apply heat. They're saying to apply ice.
Yeah. I mean, that is the general consensus, I think, over the years, which I believe there are some articles that came out that said it didn't really matter. Is that true,
Yeah.
Dr. Tom?
There was. We started to see a lot of research that came out. It was for a mixed bag review of either acute and chronic pain. It was basically like whichever the patient preferred was the one that was better for them. It was all kind of patient dependent, which I like. This one in specific for an acute injury, it really comes down to the type of injury that we're dealing with. Like, yes, ice is going to help reduce swelling more so than heat will, but heat sometimes is able to kind of gate more pain. So my acute injury, let's say I got a really bad cramp. Honestly, I wouldn't be against somebody saying putting like a hot pack on it just to help like relax the muscle a little bit more versus an ice pack is going to make everything want to tense up more. So
And also,
I'm in the middle on this one.
This guy in the second paragraph here says, typically with new injuries, I'm going to highlight it, we are trying to get swelling and inflammation under control to ease pain, reduce irritation of the area, which can help you return to normal function faster. Sometimes we actually want inflammation. Like, inflammation actually helps tissues heal. So we don't always want to get it down super fast in order to assist with the healing process.
There's also a lot of research on like blood flow getting to certain injured areas to increase healing, which is kind of like in a similar sense if we look at like another form of treatment, which is like your PRP injections where the doctors literally draw blood out, spin it in a centrifuge, take all the nutrients and blast it back in. We're basically just doing the blood's job, which is we're just taking a gigantic nutrient bomb and blasting the injured area. So by reducing inflammation, sometimes, you're going to ease the pain, but you're going to slow a healing process.
Yeah, so there's going to be positives and negatives about it. And then honestly, just in general with heat and ice, I most of the time don't even recommend it to my patients that often because it's like a Band-Aid. Like, it feels better, but most of the time it's not actually going to change anything long term. It's just like, ooh, this feels good. I like that. I'm going to use this.
It's momentary. I recommend it to patients like at the end of the day when we're not really moving around anymore. Like, all right, listen, if you're feeling really banged up and like you just want to kind of ease the pain for a moment, you can use heat or ice, whichever one you like better. It makes you feel better. If it's the middle of the winter, a lot of times they say it's freaking cold out anyway. Let's go ahead and use a hot pack instead of the ice pack. But it's all patient dependent, especially like even for acute ones, which everyone thinks like, oh, after an acute injury, like it just happened, I should probably use an ice pack, which is most commonly used. They're starting to find that heat necessarily isn't a bad thing either.
Yeah, I think when it comes down to it, like you said, it depends on the person. Like like I definitely do still sometimes tell people to use ice. Like if it's gonna help and it's gonna help you move better, yeah, sure, use heat or ice. But I always have the caveat of like there really isn't a lot of evidence for it being a great modality.
No, it's more of a comfort piece. It's like heat on an acute injury, I feel like got a bad rap because like so many doctors from back in the day said ice was the way to go because we want to reduce the swelling, but we're finding out more and more research as we're going, and it doesn't mean anything.
Agreed. Should we go on to the next one?
Yeah. The classic.
Myth
Every
number
physical
2.
therapist's worst enemy.
Rest is the best.
It ain't the worst, I'll say that.
Rest helps sometimes, and like if you're training very often, you need to rest in order for your muscles to recover. But
Yes.
if you rest a day and it hurts, and then you rest another day and it still hurts, and you rest a third day and it's getting worse, that probably doesn't mean you should rest another day.
Yeah, so if we transfer it to even to like sport related injuries, we're starting to find that early mobility and early return to activity is better than resting. So, it's like, all right, yes, a rest day isn't a bad thing if we just sprained our ankle yesterday, but if it's been a week, it's time to start getting things moving again. You can't rest it to be 100%. You got to reintroduce all these stimuluses, walking, running, jogging, especially when it comes to our athletes. And it's very common that you feel more pain in the beginning of returning to those activities because your body is still under, for lack of like using medical terminology, still hypersensitive and under the idea that there's an injury. You have to kind of rehab it. Oh, look at that.
Rehab is a good thing. I'm trying to read through this article real quick, or this paragraph real quick. The key is to keep movement gentle, slow, and as pain-free as possible.
Yes, to an extent, a little bit of pain. Like,
Yeah.
I'm not saying to push through pain, but a little bit of pain isn't necessarily a bad thing.
One of the biggest things we learned through just PT school, just working with patients, is hurt doesn't always equal harm. So just because something's hurting doesn't mean you're making things worse. Sometimes it just hurts because it hurts. It's okay. It's not the end of the world. That being said, you don't want it to be above maybe like a 5 out of 10 on a scale of 0 to 10, 10 being the worst.
Yes.
But if it's like Dr. Tom said, 1 to 4 or a low amount of pain, that's definitely okay to work through. In fact, I usually would tell people to work through that.
Yeah, because it's going to help desensitize it too.
Yeah, like depending on people's pain tolerance, they may or may not be able to work through a little bit more. And a lot of times I find it helps because that's how they retrain their brain too, to be like, it's okay for me to move and do new things and get back into my normal routine. So
the way that I explain a lot of it to my patients is that our brains are very hyper aware and they're very hypersensitive, and it doesn't really have a good way of determining like a good stimulus sometimes and a bad stimulus. So when it gets recognition of something new happening that we haven't done in a moment, it's going to first interpret it as like, all right, we're going to send the alarms. This is new. We don't know if it hurts us. So we're going to tell our bodies that it hurts until we understand it more.
mm-hmm.
Once your body starts to understand it more, then the pain levels start to come down.
Yes. And just looking a little bit more into this, there are definitely good parts of this paragraph that make a lot of sense to me. Like, shifting back to an activity, after you had an injury, something you should do slowly and ideally under supervision of a trained sports medicine specialist or a physical therapist. A lot of times with high schools or college, like athletic trainers should be able to help as well. Like have someone that guides you in the right direction and make sure you don't overdo it or underdo it too. Like that gets you going like you're supposed to.
Exactly.
I'm trying to think if there's anything else in here that I thought needed extra mentioning. I think not. I think I'm good with that section.
Yeah, when it comes down to it, you have to go back and do your activity slowly. Like if you were an athlete playing a sport, we're not necessarily going to go right back to playing it at 100%. Start out with some like light jogging drills and take it slow at first. See what your body feels like.
Mm-hmm. Yeah, and if you're not sure, definitely get people to help. Even if you are sure, it's probably better to have someone help. They always say it's better not to treat yourself and have someone help you through it. Better safe than sorry. But we shall move on. Let me try to make this look a little nicer.
If you can move it, it must not be broken.
So I actually think the opposite is if you can't move it, it must be broken is right a lot of the time.
Yes.
Like if you cannot move it, there's a good chance it's broken, especially if it's super painful, unless you have like a nerve problem or something neurological going on. Like most of the time, like if you try to put weight on your leg and you can't put any weight on it, there's probably something broken or like some ligament damage or something.
Yeah. Well, this one's specifically talking about bone break. This paragraph, just a quick look through. It's saying about like small fractures you might not necessarily like feel. Um,
Yeah, so a good
and
example is if like you broke your fibula in your leg, there's a good chance you're still gonna be able to walk around and do stuff, but
yeah.
it's still gonna be pretty painful. And there's
There's
like,
also like the fractures, non-displaced fractures that happen down in like the ulnar or the radius. Like you'll still be able to move your elbow and like slightly rotate it around. And just because you've got mobility doesn't mean that it's not broken.
mhm. That being said, I think that most of the time these are very painful too. Like it's not just
Mhm.
not gonna be painful. It's not gonna be painful. Is that? It's gonna hurt. That's what I'm getting
Yeah,
at.
it ain't gonna feel good.
Unless you have like I said, like a nerve issue, most of the time it's gonna hurt pretty bad. Actually,
Yeah,
um, osteoporotic fractures can definitely happen, and people just tend to live their life, and a lot of times can get back to normal even after a fracture, and never even knew they broke a bone, like and especially in your back with
I
osteoporosis.
yeah. I mean, I was about to say too. Like I've had a lot of like fractures with like thoracic spine compression fractures with people who were osteoporotic who didn't even know that they had the fracture. They went and got an X-ray
Mm-hmm.
and they're like, wait a minute, my back's broken. So there can be some that are, asymptomatic. That's why it's really important to understand the signs and symptoms of like that potential fracture. One being the mechanism of the injury, if it was like if it had the ability and the force to cause a fracture is a big one. Even there, it also says persistent pain, swelling, tenderness, or bruising is common. There's a lot of blood flow that goes to bone, so when we fracture it, you're gonna get some bruising too. But it all depends. There's all different kinds of fractures. Like, yeah, hey, listen, if your bone is sticking out of your body, yeah, you definitely fractured it. You might not be able to move it. Don't. But there's small hairline fractures. There's just things you have to watch out for.
Yeah, when it comes down to it, it's a very gray area. Sorry, I had another brain fart there, but it's a very gray area with all this stuff. There's never going to be 100% definite yes or no.
Yeah,
Um,
but for this myth, if you can move it, it must not be broken. No, that's false. Just because you can move it doesn't mean that there isn't going to be a fracture there.
the Athletic Mythbusters bust that myth. Now let's go to the next
Yeah.
one. Oh, come on, thing, be nice to me. Okay, you can run through shin splints and they will go away.
I wish that we had like a button I could do like a phone in a friend right now. Like the how many runners have we interviewed now,
Yeah,
Aaron? I mean, granted, the runners are also physical therapists, but take
yeah.
away the PT brain in them, and then just their running history. I'm curious what they would think of this one.
So I have a perfect example, and it is from like a week or two ago. One of my cousins is doing the Spartan race with us. Dr. Tom is still unsure if he's doing it or not.
I need a contract.
You will get no dollars to do it, but you'll have a great weekend.
Extension isn't going the way that I want it to.
But yeah, one of my cousins was talking to me. Shout out to D. And he was telling me how he was running 3 or 4 times a week. He was probably running, I think he said 2 or 3 miles every time he did it, and he was getting shin splints, so his shins were hurting a lot, and he couldn't figure out how to get it better. And basically, what I told him is to stop doing 3 or 4 times a week, just do 2 times a week, because his body just wasn't used to all that volume with running, because he didn't do any running, and then went right into doing that. And once he did that, his shin splints actually went away. So he decreased his load, his frequency, and his shin splints got better.
Yeah.
So
Um,
I guess that's my long-winded way of saying is a lot of times shin splints are because of overuse. So you probably want to take some time off or maybe decrease your dosage of running.
Yeah, it comes down to shin splints are exactly as Dr. Aaron described it. It's an overuse injury, which a lot of injuries are overuse injuries, but that's a very big overuse injury. And if you continue to work through it, you're going to cause more damage. Even on the article, it's Dr. Guzman, who's interviewed for the article, states that like shin splints are microfractures to the tibia bone, which sounds scary. You know, you're running on these microfractures. They're not going to be harmful. They're just going to be painful. And if you continue to run on, they're going to get more and more painful. You need to give them the actual. Go back to myth number, I think, two. You do need to give them some rest. Not complete rest, but dial it back a little bit, let them heal, and you should be able to continue.
Mm-hmm. I think we can go right into the next one. I didn't really look through that paragraph too much, but I think we covered most of it.
Yeah, I think so too.
All right, let's head over to our last and final myth. Myth number 5.
Mhm.
Surgery is your your only option.
At the end of the day, yes, surgery is always your only option. I agree with this myth. I think we can now end the video, Aaron. That's pretty much it.
Yeah,
if you're hurting,
we
have to cut you open.
Anytime there's pain, you should really just have surgery. It's really all you can ever do.
There's no point in seeing guys like me and Aaron when there's surgery.
Yeah. In fact, I would probably skip physical therapy and just get surgery. For all of our viewers who don't know, we are being sarcastic. Surgery is not your only option.
No, it even states it right there. You can go and see a physical therapist to help rehab you.
Hey.
It all depends on the extent of the injury. Now, of course, like I stated before, if you fracture something and your bone is sticking out of your body, me and Dr. Aaron are not going to force that back in and rehab you to full health. You need surgery.
Yes.
But for a lot of these overuse injuries, example above, shin splints. That's something me and Dr. Aaron see very commonly in the clinic. That's something that is very treatable that we can work with.
Mm-hmm. And there's a lot of other things too, like you strain your back picking something up off the ground, you're doing a workout, you hurt maybe your shoulder or something like that. A lot of times, even with like a rotator cuff tear, we can treat those things, get them stronger, and you can work back from it. A lot of cases too, I would say surgery is like the last possible thing you want to do, specifically with like back pain problems or neck pain. There's really not a lot of evidence for surgery that it's actually good. A lot of times it's 50-50. It doesn't really help too much. And sometimes it can make it worse. Sometimes it does make it better. But it really should be like, okay, I tried physical therapy. It didn't work. I tried every little possible thing that I could have possibly tried and nothing worked. As far as like a back or like maybe a neck issue.
Yes.
Like Dr. Tom said, there's definitely some areas it's like you gotta have surgery. Like there's nothing you can do. Bone sticking out, you gotta have surgery. Even some neurological things too. It's not necessarily surgery. Because I guess it is like neurological or cardio. Like if your heart's having issues, you can't just outwork it and make it better. In fact, that would probably make it worse. You need to have maybe a cabbage or something like that. And then neurologically, like you need to have blood thinners. Maybe you need to have like a stent put in, something like that. I think that's going way off of what they were talking about here, but
that's another injury form.
Yeah.
But no, at the end of the day, no, which is okay. I mean, I love our soapbox rants. That happens to us on this show pretty often, and it's always fantastic. But at the end of the day, no, surgery is not always your only option. I actually oftentimes will tell patients like, listen, like I feel very confident that I can get you better. I know that the doctor wants to try surgery, but or wants to perform surgery, but I'm going to recommend, and again, injury dependent. I'm going to recommend giving me a shot for a month. And if you don't see any improvement at all, or you don't feel like we can get there, then we can go back to the surgery as an option. But that's something you can keep in your back pocket.
So that's interesting because I almost never say a guarantee of anything to my patients. Like it's always like, we'll see how it goes, but I don't know what's going to happen.
I'm not guaranteeing. I'm just saying, give me a shot and let me see what I can do for you, and then we'll go back.
Yeah, because it's like all you need is to tell someone they're going to get better, and then a month later they're like, I'm not better, and it's your fault. Because when it comes down to it, a majority of the time, it sounds like a cop-out, it's not our fault. It's maybe the person isn't doing their home exercise program. Maybe they have other things going on. we most of the time guide people in the right direction. It's just about what you do with the information that you get.
And some of it can be like psychosocial for people too, you know, your perception of pain and what it feels like, your tolerance to it as well. Sometimes you have to kind of factor all that stuff in. But at the end of the day, there's many different options other than surgery. There's physical therapy, but then there's also different forms of medication too. There's like I've seen injections that work. I've seen medications that also help as well too. So like they're saying in the article, there's a multidisciplinary team. There's a lot of
Yep.
different people who can look at this and a lot of different specialists
Yep.
before we have to consider surgery.
Sometimes there's OT, sometimes there's just diet and exercise, like lose some weight, eat healthier can actually help with pain levels as well. It's not like a one facet approach to it. It's multifactorial.
Oh yes.
But I believe this is the end of this article. So I'm gonna
Dr. Aaron, you want to bring us up nice and close again? There we go. I love it.
close them together. That's how we like it.
Well, I think that basically covers it. If you guys have an article or something that you want us to go through and give our opinions and review on it, send it our way. We're always down to take a look and see. But yeah, I think that covers everything. Aaron, you got anything you want to say?
That sounds good to me. Thank you, everybody, for watching, and have a nice night or day.